In this video, I'm going to briefly talk about exercise in relation to weight. I have mentioned in prior videos that the purpose of this channel is to try and bring useful information about exercise and exercise videos to patients who suffer from any kind of chronic illness. However, it would be difficult to never mention weight. So I'm going to discuss it briefly here, and I won't really be focusing on weight on this channel going forward. So weight is highly complex, and what determines your weight will depend upon genetic factors, environmental factors, stress, emotions, diet, other lifestyle factors. When it comes to overweight and obesity, the question really is, are there any other risk factors for diseases along with being overweight or living with obesity? And by that I mean, do you also suffer from high blood pressure, high cholesterol, pre-diabetes or diabetes? If you don't, then I would argue that you want rather than need to lose weight, and that obviously is entirely the choice of the person. If, however, you do have some of those risk factors, and again, that will be things like high blood pressure, high cholesterol, pre-diabetes or diabetes, or other cardiovascular risk factors, then it may be more appropriate for you to lose weight. However, this should only be done in conjunction with a healthcare professional and will involve both a diet approach as well as lifestyle and exercise programs. So when it comes to the question of weight loss with exercise, I would say it's not really the correct question to be asking, because regardless of the number on the scale and regardless of what your clothing looks like on you, if you engage in regular exercise, and even more so if you go from a sedentary lifestyle to an active lifestyle, you will gain all of the health benefits from the exercise regardless of what the number on the scale is. You will gain the cardiovascular benefits, you will boost your immune function, and you will boost your energy levels throughout the day. You will significantly lower your risk of developing cardiovascular diseases and stroke going forward. You will lower your risk of developing diabetes. You will lower your risk of many other inflammatory conditions, and that has nothing got to do with the number on the scale. So when it comes to weight loss with exercise, the question is raised, can you actually do it? So again, I wouldn't necessarily focus on whether or not you can or cannot lose weight with exercise, because it'll come down to many different factors. It'll come down to the starting point that you're at when you engage in the exercise, the amount of exercise you're going to do, and the type of exercise you are going to do. It should also be remembered that if you do choose to engage in regular exercise, again, regardless of the number on the scale, you will naturally over time develop a greater muscle mass than a fat mass. And we do know that muscle is far more metabolically efficient and active than fat. For example, your muscle is where you store a lot of your glucose and glycogen, which you break down throughout the day in order to supply energy. This is one of the reasons why exercise leads to greater energy levels. So all I'll say about weight and weight gain in relation to exercise is I wouldn't advise that to be your goal when you engage in an exercise program. If you do feel you are overweight, or you do feel that you are living with obesity, and you engage in an exercise program and you do lose some weight, well, that can be seen as a positive benefit for you. But I wouldn't be discouraged if you didn't lose weight, because you are still gaining all of the many health benefits regardless of the number on the scale.